just
recording is on.
I think we've started recording.
We're recording.
We are recording. So a little bit of a chat this afternoon. It'd be great to get to know you guys a little bit better so that we can signpost you. Just to say that you have entered into the nursing and midwifery breakout room. So if you were expecting to be with scientists, AHPs or medical colleagues, you're in the wrong room. If you are in the right room, then you are very welcome and it's great to see you. So my name's Louise Bramley. I'm Head of Nursing and Midwifery Research at NUH and work with the team that are here today to support capacity and capability for nurses and midwives to do research within the Trust. Jo?
Hi everyone, I'm Jo Cooper, Assistant Director of Nursing for Research, Innovation and Professional Regulation. I work with Louise and Helen, and I'm also Head of Nursing Research Transformation for NHS England and Improvement 3 days a week. So I have two roles, but it's great to be with you today. Thanks for joining us.
Thank you, Jo. We're very lucky because not many people on the breakout rooms today that have got the national leader in the room, so that's wonderful. So Helen?
Hi everybody, my name's Helen Janiszewski. I'm the clinical lead for Nursing and Midwifery Research and Innovation.
Thank you. And then Hannah?
Hi everybody, my name's Hannah. I am a registered nurse at NUH and I'm currently on that ICA pathway that you've probably already heard about. So I'm doing a pre-doctoral clinical academic fellowship.
Wonderful, thank you, Hannah. So could I ask you guys that are with us today to also introduce yourselves? I'm just going to go down the list that I've got, and the first person that pops up is Ruby. If you're talking to us, Ruby, you just need to take yourself off mute. Not sure if she's experiencing technical problems because she can't use a camera at the moment, so we'll keep going. So Helena?
Hi, can you hear me?
Yes, thank you.
I'm going to turn on my camera.
Hi, Helena.
I'm Helena. I'm a doctoral student at King's College London. I'm on my third year of PhD, so doing my data analysis and writing up. I am exploring what to do next. I'm a nurse by background. I work in diabetes and kidney disease. So I practice 1 day a week during my PhD training. Before that, I was a full-time clinician. So yeah, I'm here to discuss what clinical career pathways are there to tap into, and just also chat and get to know people a bit more.
Wow, wonderful. Welcome. That's awesome. Thank you very much. Ashley?
Hi, my name's Ashley. I am a midwife at NUH, but as far as that goes, I'm not currently involved in anything any more than being a registered midwife. I just was looking, it's something that I'm interested in and just wanted a bit more of an idea of what's available.
Wonderful, thank you. It's really great to see you, Ashley. Welcome. We've got I've got Ashley, but it looks like Ashley has our tech support, so I don't know if you just wanted to say a quick hello. Not sure if it's and what I can't do for some reason is move down. So we've got Chloe with us. Chloe, hi.
Hello?
Hi.
Hi.
Hi, sorry, I'm in the car. Can you hear me okay?
Yes, thank you.
I'm on annual leave today, so we're just going. But I wanted to log into the event because I was very interested. Okay, so my name is Chloe. I'm a research nurse at NUH. I'm currently working with the rapid response team there, which was the COVID-19 research team. I just wanted to attend this event to get an idea of what being a clinical academic is all about, and to network with other people in nursing and midwifery who are also in the same in that role.
Brilliant, welcome. Well, you get the 10 points for tenacity, because I think you're actually in transit, which is a wonderful achievement, I think, in today's technological advances.
We're on our way to Norfolk. So,
oh, nice.
Forgive me
Nice.
for issues with the camera. I think I'll turn it off at points so that you can't see the motion. It's a bit disruptive.
Brilliant, thank you. Oh, you're very welcome. Wonderful. So I've invited Hannah with us today. Did you want to say anything?
Sorry, were you talking to me, Louise, just then?
Sorry, I was just talking to Jo. I thought she tried to say something.
I thought you said Hannah.
No, sorry.
I'm sure she said Hannah. So I was just going to say that Ruby's put something in the chat.
Okay.
Ruby's a registered nurse in spinal theatres at QMC. Was invited by one of the nursing educators to attend. So I told her I was interested in nursing research. So you're very welcome, Ruby. And great that the educators are really starting to share around these opportunities, isn't it? So hi.
Wonderful, thank you. So I'm just going to invite Hannah, if that's okay. Now, obviously, we've got people who are at different stages. So there's 3 of you, I think, that are really interested in trying to understand a little bit more. So one of the things that I think might be quite nice, Helena, given that you are already along this journey, if there is something that you want to share with how you got to where you got to with the group, or bring some of your expertise on being on this journey in. And then we can talk a little bit about some of the opportunities that we've got at NUH, which go from the very beginning of your clinical academic career and developing your research skills, right the way up to kind of postdoctoral opportunities that we've got here. So Hannah, I'm going to hand you over to Hannah, who will just for a few minutes tell you a little bit about her experiences, why she came to a clinical academic career, and the fellowship that she was successful in getting. So thanks, Hannah.
Thank you. Yeah, thank you for inviting me. Please feel free to ask any questions to me. I'm really happy to answer anything. So actually, when you introduced yourself, I was in a really similar position. So I came to Nottingham in 2015, having qualified as a nurse in York, and moved down here to start my career. And like you, I was working as staff grade, hadn't had any research experience as such. And the way I got into clinical academic careers was that I was asking questions about why we do what we do, and is that always the best way? And I was frustrated at times that sometimes I was in a situation where I thought, actually, I think that my education means that I might be able to do something differently, but yet we're working in a certain structure. And it was when thinking about that and thinking around the opportunities that there are in practice that I started to consider going into a clinical academic career, although at the time I didn't really quite understand that that was what I was talking about. So what I was trying to articulate was that I was had questions that I wanted answers to, and that I wanted to be the one to ask them and find those answers. So that led me to approach a clinical academic career, which allows you to do such a thing. So for me, it's about nurses or midwives leading and saying, actually, in practice, this is something that we need to look at, and this is important because of X, Y, and Z. So I started on a pathway which was at the time called the Bronze, and I hope that Helen, Louise, and Jo might be able to just say what that's called now. I know that the name of it has changed, but it's right at the start of that pathway. And what it was a module, almost like a taster, like an hors d'oeuvre to what having a research career and the training that you need to undertake a research career would look like. So for that, I went to the University of Lincoln for 1 day for so many months. And then I created and then did a piece of work on a research on a topic. Now, what was really fascinating for me was that the thing that I thought that I was asking wasn't the thing that I ended up looking at, and therefore I had developed over that course. I now am a pre-doctoral clinical academic fellow, which sounds quite fancy, but it's really not. It's basically that I'm doing a master's in research methods on the anticipation that it will prepare me to do a doctoral fellowship, which sounds like what Helena is doing, and so she'd be able to talk a lot about that. So part of the pre-doctoral clinical academic fellowship is where I marry what is happening in the academic world, so the thing that I'm looking at, which is clinical decision support systems, so technology, and how that influences decision making in practice, and then marrying that with what is actually going on in practice, so that your career is both academic and you're becoming academically proficient as well as clinically capable, and the anticipation that on leaving that you're able to translate that into something that means something in practice and make a difference basically to patient care. So that's where I sit at the moment. So my time is split 80-20, so 80% of the time is undertaking a master's in research methods, and then that 0.2 is that clinical component, of which I organise with different leads across the country to work with in order to look at how they're building capacity and capabilities in digital technology, almost like across the country. So that's my journey so far. I am 6 months into the fellowship, and when I prepared for it, I wasn't preparing for a world of COVID, and so things have had to change and had to adapt, and I'm sure that that's the same for people as they're moving through these processes despite the pandemic. So that is me, and I'm happy for any questions, or if you think I might have missed something or would like to know any more about that.
Thanks, Hannah. I don't know if you guys have got any questions that you want to ask Hannah. Ashley's just putting in the chat. That's great. Yeah. Thank you. Thanks. Is that something, Ashley, that you would like to think about as you progress in your career? How do you feel about that?
Yeah, it's definitely something that interests me. I'm doing at the moment the evidence in nursing and midwifery course at NUH, and I think it's all a bit, I don't have a specific idea of something I want to research or any specific problem to solve in our practice. I think that's the bit where I feel a bit I feel like I'm not quite ready for that yet, but I don't know whether that's something you need to be able to apply for the internship if you already have to have an idea for a project, or whether it's just in terms of developing your clinical research skills.
Hannah, did you want to respond?
Yeah, absolutely. And I think that was something that I was a little bit nervous about. And for me, it was more about exploring the why, and then that develops. And the clinical academic career pathway is set out because it is a learning experience. So at the very start, you are learning about why we do what we do and exploring that from an academic and a clinical perspective, and joining up the two. And sometimes the academic why is the reason that isn't implemented, or the reason that doesn't come to fruition is because of a clinical why, and then it's our role to sort of navigate that and think about that with the expertise we have. But I view it as a journey of education and learning, and I'm sure that others that are even at the other end of that and have completed all of their education training would still say the same. For the as I said, for the first step of it, the thing that I was asking why about doesn't have anything to do with what I produced at the end, nor what I've taken forward towards this pre-doctoral fellowship. So I was asking about fluid balances, and what came from that was actually about nurses' decision making. But I didn't realise at the time that was exactly what I was asking about and looking at. And it was only through reading and that journey and that education that I recognised that when you're getting a little bit further on, you'll find that you articulate that a lot better. And I know that I spent a lot of time with Jo and Louise when I was preparing for the fellowship, still trying to articulate exactly what it was that I was trying to ask. So it definitely is a journey, and but it starts with that why question, that wanting to look a little bit deeper into things.
Thank you, Hannah. I think, did we just have somebody else join us? The Amaruthra. Hello. I'm not sure if you're on mute, Amaruthra, or you're just listening to us, but we're just discussing nursing and midwifery research careers. So if you're unable to talk to us, please do pop something in the chat and say hello. Joe has just posted something in the chat around a researcher development framework. So Joe, do you want to talk a little bit about that? Thanks.
Thank you. Yeah, and I suppose this relates as well to, Helena, in terms of your career development. A clinical academic career is it's not a one size fits all, but it is in a way what it says on the tin. It's that kind of combination of a development in terms of both clinical and research leadership, and more formal academic training, and it is a journey. So, I mean, I don't know how others perceive a PhD sometimes years ago. A lot of us don't even understand, for example, what a PhD means. What does it mean to have master's level training in research? And it's all of that journey, really. You take on your ongoing clinical development. Within that, you are the expert within your clinical area. You know what the challenges are, and sometimes they change. Sometimes you will be confident in what some of the gaps are. But what you do have is your connection with patients, families, communities that will continue to drive it. And that is within the context of then using this framework that you've got access to. It's online. We do a Step into Clinical Academic Careers program here where we can work with you. What our experience of academic development is, it's an academic course where you have to do it mainly on your own. This is a journey that you go on with others. And so if you remember nothing, I would ask you to consider it's about your networks, how you garner and open up support from people such as ourselves. Don't feel you can or have to in any way do this on your own. Even thinking about what the question is now, who might be that expert team around me? Even though I'm on a PhD program, what does that mean for going forward? How do I get that A team? Never think you know it all, because you don't, and we all know that we don't. But that's quite normal. What we don't have nationally is a real clear program, but I don't think it's easy for medics either. So it's about how we come together as communities of nurses and midwives and support each other. What the framework will give you, and has been really useful, I mean, Helen, you've got cards and things, haven't you, that goes with it, just helps you map where am I now, and not just about research, but about my whole skill set, because that is a really good starting point. So it might be just as a useful strategy to start there. And because, I've been postdoctoral now for a decade, still got loads of learning to do. I'm not an expert in every piece of research. And as my leadership still continues to develop nationally, I need people around me, and so will you. And as we can come together as a community, then I think that's really important. So please have a look at it and see what you think. But in terms of our careers here, we are really trying to help people come alongside and help people navigate this whole journey, which includes not only your research question, but what does a role look like, and how do I really contribute, not just this year, but in 5 to 10 years' time on patient outcome. So, yeah, I'll stop there. I hope that's been useful.
Thank you. Has anyone got any questions that spring to mind around some of the things that Joe's just said? Well, if you do, just give us a shout.
Yeah,
one of the things that I'm also going to post in the chat is NHS Scotland developed a really good careers framework. You can utilise alongside the VTI framework to support you think around clinical and research elements of your career at the same time. So I'll post a link to that in a second. So I think, as Joe mentioned, as Hannah mentioned, one of the things that we find for nurses and midwives, both here at NUH and many of us, Helen, myself and Joe, have all supported people both regionally and nationally as well in this area. There's around feeling like you don't feel confident enough to go to it, we need some extra support. So we have developed a programme at NUH. We've got a couple of options really, and I think you mentioned it, Ashley. We've got the Evidence in Nursing course, which does give people here, particularly at ward level, a bit of a flavour around innovation, research. We have one of our doctoral researchers, Elly, who's almost at the end, who runs that programme and has been developing it. It's an opportunity to learn some skills. So if you're sitting here thinking you want a bit more of a taster, you want to stand a little bit more, that runs every year. It's running at the moment. The very first session hasn't begun, so if you do want to join that, just if you could let us know, there's an opportunity for you to join that. Ashley, I think you've done an introduction day, haven't you? And I think there's more days coming up in the next few months and weeks. Have you had your first session with Elly? I can't remember. I think it was a couple of Thursdays ago, I think, wasn't it?
Yeah, we have had the first session.
Yeah. So if people are interested and they want to have a little think about that, do get in touch. Helen, I don't know if you wanted to say a little bit about, we've got a Step Into programme at NUH that can help support, as a programme that Hannah's also done, and some of the internship and mentorship and support that we can give here at NUH to support applications.
Yeah, definitely. So I think the main thing, which I know Claire talked about at the previous presentation, was around, whilst the internships and the like the PCAF and the bridges are really competitive, it's about how you really make sure you've got that well designed, real strengthened application. And so these programs are there to help, start at the very beginning, give you that good network to really guide you through that process, so that when it comes to applying, you've got that kind of network in place, you've got a really, really sound application. So in the first instance with, the internship, which is what Hannah referred to when she did the bronze, I believe that's the new name for it. And that, we can sort of give you some support with looking at the application process for that, if that's what you're interested in doing. And then also there's the kind of more formal programme. So there's a Step Into PCAF, which is a 12-month programme that sort of starts to give you the foundations really towards looking at not only what your project is, but what other skills you need in terms of really strengthening your application. So things like publication, somebody talked to me about publication years ago and I was like, oh, I definitely can't publish. I've got nothing to say, there's nothing of any interest I've done. But, we were all doing things that are really, really interesting, whether it's a, patient improvement project or a service improvement project, or, even an evaluation of something. It's about that kind of information sharing with our peers. So publication, I think, is a real key thing in terms of strengthening an application, and that's something that's looked at within the programme. And then there's the Step Into PhD, which is the next step. So once you've done a PCAF, or even if you feel that you've perhaps already got a master's and you've done some formal research training and you don't need a PCAF, and you just want to go straight for a PhD, these there's lots of different PhD options out there really, some which are better funded than others really. And so this programme will help you kind of look at what all the options are and look at how you really get a good application that meets the need of the PhD that you're thinking of applying for. But as Louise said before, we're here to support with any of that. So, you don't have to sort of put yourself on a formal programme to get any support. You can absolutely contact us at any point and we can, start to look at perhaps what the best fit is for you, or what you could be doing kind of, in the lead up to these opportunities becoming available.
Absolutely, Helen. In fact, I would say the earlier the better, even if all is, like you've done today, I'm not quite sure what or why or in what way, but I'm really interested, because Rachel Everly talked about that, 9 to 12 months kind of time period for getting a strong application. We do know, in nursing and midwifery, because of some of our professional backgrounds and some of our gaps in training and confidence, it can take even longer than that. So, the earlier the better to start those It's not just about the question, it's equally around the work that we do with patients and partnerships to really drill down. Nothing is stopping us doing that. No funding, no requirements. We should be doing it. And there's, that's early work that we could get on with. So please don't hesitate to do that. Could I just take liberty and ask, is it Helena from London? What's it like where you are in terms of support and the research culture? Can you share with us for clinical academics, what's it like there?
Hi, Joe. Thanks. I'm just so jealous that I'm not in Nottingham. I think in London it could be quite variable. So clinically, I work at the Royal Free, which is in North London. My PhD is in King's, and King's has allied partners that, obviously King's College Hospital and guys in St. Thomas's. I believe they have much more better system and infrastructure supporting clinicians, be it nurses or allied health professionals, with their career and journeys and opportunities. Whereas up north of the river, it's a bit more of a challenge. But I've got really fantastic mentors who have been so helpful to me in terms of navigating what I, should consider and weigh up in my career. So some of it is negotiating and, paving the way and creating the opportunity for yourself. I am looking forward to going back to clinical work with a split of 50-50 clinical and research role. At the moment, it's been agreed, yes, but it's not officially on a contract yet. So I'm eagerly waiting for that. But, Joe, what I would ask is, it shouldn't be that individuals had to pave their way. Fine, it's an experience for me, but it should be readily, clearly available as a roadmap. I'm sure, I've been focused on my data analysis and writing up and things like that. So I haven't paid a lot more attention to the resources that you've shared with us. And maybe they are already there that I am behind in catching up with that. But it strikes me for medics, it's just clearly laid out and it's, much more easier to make the decision. Whereas for me as a nurse, I don't think those options were clear to me when I first started. The journey of PhD has definitely made me aware of different options and things to do in line with what your interest is. And for me, my initial reason was actually I work with a very specialist in a very specialist area in that there wasn't a lot of research done within those groups, and they're very clinically vulnerable, therefore they're excluded from a lot of trials and things like that. So a lot of their care and management is very much on the opinion of clinicians. I think that's what you do when you don't have enough evidence. But that was an opportunity for me because I was getting quite frustrated in that, we can't just let this be and just, leave life as it is. We have to find a way. And I'm really hopeful that my output from the PhD training publication will be of some use in clinical areas. I think I've spoken a lot, so I'm just going to be quiet.
Thank you, and well done you. You're right. We need clarity, and that's part of the national work. Thank you. Over to you, Louise.
Thank you. No, it's almost like speak of the devil and these shall appear. So Elly joined us halfway through. I think you've had some connection problems, haven't you, Elly? We were just talking a little bit before about the evidence in nursing course, just as a kind of taster. And I think one of our people that's joined us today on the call, Ashley, is on the evidence in nursing course. So she's from, it's evidence in nursing midwifery. Ashley's a midwife, so she's joined us today on the call. And I think on the screen that you'll be able to see now, you'll be able to see a picture of us all. If you scroll down at the main page, you'll see a whiteboard, and then just below that there is a link to a video that one of our clinical lecturers who's been successful on the NIHR pathways done as a little video. You can be able to view that at your leisure after the session's finished today. So we can't share videos as such on this particular platform, but it will be there for you to have a look afterwards. So please do feel free to have a look. I think that, thanks Helena, that's really great to hear other people's experiences. I think it's just really pushing the point that often research starts with what makes you confused or cross or frustrated in clinical practice, or something that really you see that's great that you want to see replicated elsewhere. And I think that's what Hannah was alluding to when she was talking about where her research started, and then with the development and the support where that ended up. And I think Hannah will probably be quite happy to sort of say that she needed quite a lot of support and mentorship and meeting with myself and Joe and latterly Helen and Elly to discuss through those ideas. And that's how we get to the point where you feel that you are then ready to go towards applying for some of the funding to get some of the research training. And Joe's right. You just need a really tiny little flash of excitement in your belly when you think about research and the possibilities of what that might be, even if you don't understand it at this point. And we've had, Joe's the national leader in this for a reason, because we've been quite successful at NUH. So it's great that you are all here to hear some of that. We've got about 10 minutes left before the end of this session. I think what I want to say is, if you are wanting to get in touch with us, please do email. We are all on the NUH system. Helena, if you do want to get in touch, and we'll put some email addresses in the chat for you to get in touch with us, so we could talk a bit more bespoke around opportunities that might be available for careers more broadly here. I think it's imperative that you get in touch. It's a great time of year to get in touch. The internship programme opportunities are around at the moment. They don't close until the end of June. There's plenty of time to get initial application in for the internship, because unlike some of the big fellowships, what these internships will give you is a very small amount of time out of clinical practice that's funded to help and to support you to think about your research ideas. So, has anybody got any further questions, any thoughts that they wanted to share? Helen and Hannah or Joe, I don't know if you want to come in.
I think my experience was I did a master's in midwifery, which had a research element in it. And so to me, I felt like I was quite adequately prepared in the research world. But did do so. It was just the year before it changed to the PCAF. I did the Masters in Clinical Research, and for me, it was that kind of the element of being able to undertake some research was amazing and kind of really liberating, because I could look at what I wanted to. But that formal research training is so different when it's part of a kind of a research program rather than integrated into another program. And I think that's probably something that I think until I'd actually done it, I wasn't really aware of the differences. So I think, it's that kind of these opportunities to access that formal research training is so valuable. And, these kind of opportunities through internships and PCAFs are just fabulous, really, and have really kind of set me up for where I've gone next.
Thanks, Helen. That's really helpful. Elly, did you want to say anything about your almost finished journey?
I know, yes. I think I heard, so one of my supervisors did her inaugural lecture, Carolyn Tarrant, who's over at Sapphire in Leicester, and she described her PhD as not being so much of a race, but more of a marathon. And I thought that is such a good way of describing it, because what it's about is making sure that however long it takes, there's a steady pace to it, that you've got that steady pace. And I think that really, I'm only just now realizing that. I'm only just realizing that it is a training. I get it now that it is absolutely a training. And without doubt, if I think of my journey, which started in 2012 because of Joe and because of Louise, and the sudden realization that this was something that actually, not that I really wanted to do, that I needed to do. It was something I needed to do. It's had quite a long trajectory, but I think the opportunity on the way to meet so many phenomenal people just keeps that motivation. And has led to some amazing pieces of work that we've been able to undertake as a trust together around skin integrity, being part of some phenomenal studies, which are led by nurses in this instance, but actually that would be the same for midwives and allied health professionals. So I think for me, it is absolutely that it's keeping going at a steady pace, but making sure that you have access to all of the right people and having the courage. And sometimes it's a bit brave to go out there, and you think networking's easy. As a nurse, we're a midwife, we're brought up, our whole ethos is about developing rapport and getting to know people quite quickly. But I think actually when it comes to when it's about you and about you going out there, it can be, even the most gregarious and outgoing of us, it can be quite challenging. So yeah, and that support, about having the right supervisors and the right support and the right team around you, really important. And I feel really quite blessed that I've had and still have and will continue to have that. So yeah, I'm getting a bit gushy now.
No, I completely agree.
I'm a bit emotional. I'm not, I think we will be. But yeah, I see that now though. I didn't see it at the beginning. I see it.
Of course. Go on, Helen.
No, sorry. And I think, that's around that kind of, that planning time. Once you've had, I can remember I spoke to Joe, it's at the Nursing and Midwifery Awards at NUH. And I just said to Joe, very kind of almost a bit kind of flippantly, oh, I want to do a PhD. And Joe said, well, talk to me another day. And this is what you need to look at. And it was kind of, I started to kind of, once I'd had that idea that that's what I wanted to do, I started to use that time to network. And, so I applied for the Maths in Research twice and was unsuccessful the first time, but then completely changed what I wanted to look at. And so I think that kind of shows it's not necessarily, it's not the idea that's the be all and end all. It's just that vision of that's what you want to do, and you want to kind of make those changes to practice. And the network that I developed during the first application is the network that I kept for the second, because it's not necessarily around their specialist knowledge in your particular area, although that is helpful, but it's around those people that share that same vision and that same ambition that you've got.
Great, thank you. I think Chloe, you as a research nurse, we've got some real successes in NUH, where we've had those that have come from the research delivery workforce that have gone on to do masters and PhDs in research methods and combined research and clinical practice. I don't know how much of us you've been able to hear while you're on the road. I don't know if you've got any questions or.
No, I think that's fine. Yeah, I've been able to hear everything. It's been really interesting. Especially for myself, I'm really passionate about clinical care and improving clinical care. So I think the combination of the two is great, because research is currently what I'm in at the moment.
Great.
It's very new territory though for me.
Yeah,
this
exactly.
clinical academic. I know there was something last year in the EEE festival that unfortunately I missed. So it's very new territory, and I'm just kind of learning about it.
Yeah, we're just organising the EEE programme again this year, so we'll be online again this year. And Helen's putting that programme together, and again there'll be lots of development sessions peppered throughout the week around publication, around applications for fellowships, around clinical academic careers. So lots of opportunity, but please do come and talk to us, Chloe, because if you were looking at it at EEE last year, you're obviously interested. So if you can come and make contact with us, we can absolutely help and start to support you to do more. We've just got a few minutes left. I don't know if any of the other guys, I don't know if anything in the chat, or Ashley, if you wanted to ask anything. I think, is it Ruby that's in the chat? Any specific questions you've got, Ruby, or anything you wanted to ask Ashley? Oh,
Might be having technical problems, Louise.
yeah, I never know how long to leave it
Difficult,
until
isn't
people's
it?
ears, isn't it? Yeah. Okay. Hannah, as our latest success, and already doing it and being in it and growing that confidence over the last few months and really over the last year and really starting to fly. Just a couple of minutes left before we join the main session for close. I don't know if you've got any words of wisdom or any top tips you on the spot that you'd like to share.
Yeah, sure. So I really hear what you were saying about the support, and I think, do you know, in nursing, we all know how to become a ward manager and a matron and a divisional. You know, that's really set out, and it's not innate knowledge coming from a nursing career and a nursing undergraduate degree into what a clinical academic career firstly is, secondly what it looks like, and thirdly where you're going to be come the end of it almost. And I didn't fully understand it and did require a lot of support in order to get there. And sometimes it can feel daunting that I'm not sure what the end product is, but also it's quite a cool opportunity, because whilst you don't know, there is then a real opportunity to mold that in the image that you see fitting you and your career and what you think that benefit is. I really hear what Elly has said about it being a marathon, and sometimes it isn't always about having those answers or even the questions, but just starting that conversation. And my first conversation was with Louise, and I was just saying, I'm not sure that nursing is right for me. I'm feeling quite frustrated. But what I didn't realise was that there was this entire opportunity for me to actually challenge that or look into that a little bit more. So it does start with those conversations, and you know, anyone's happy to have those. Networking is a really big part of it, which is something that, as when working in a clinical environment or in like a staff nurse position or wherever, that's not always really a thing as such, the networking. And therefore, that was something I really needed to learn and get the support with. So approaching people who are leads nationally was quite intimidating for me, and I didn't really know the etiquette as to how to go about doing that. And that's why here at Nottingham, it's really great, because everybody is there to support you, having already been through that, showing you how to go about it. And now I don't really have any concerns with approaching people, explaining who I am, what I'm looking for, etc., etc. But I suppose my main pearl of wisdom would be that it does all start with a curious mind and a conversation, and it really does stem from there. And clinical academic career is a spectrum, and it's what fits for you, and it is about making a contribution to patient care, which is why we're all here, and I think it's just a super cool opportunity.
Wonderful, thank you, Hannah. That's great. Joe, I don't know. I think we just had a thing flash up saying that this session's due to finish at 2:30. So, I mean, there's obviously time for people just to have a little stretch of the legs, etc. But no, Joe, if there's anything else that you wanted to share with us, any developments?
Just so in terms of the national developments, myself and Professor Alison Richardson, who also works as Head of Nursing Research with Ruth May, she's Academic Leadership and Strategy, I'm Research Transformation. We are working on a strategic plan that will be the nursing contribution for research in relation to the Department of Health and Social Care has just set out the new vision for research clinical delivery. I'd encourage you all to look at that. You'll see that Hannah digitally enabled nursing and digitally enabled innovations is very much part of that, as is, you know, the whole system and public health approach. So it's useful that as professions, both nursing and midwifery. And for midwifery, it's Professor Jane Sandall, who's the head of midwifery research nationally. We also have Professor Ruth Endicott, who's been appointed as the nursing director at the NIHR. So I think it's a real positive time for the profession. We have a chief nurse nationally who's absolutely committed to research, to raising the profile of the nursing midwifery voice. But I suppose for us, it's how we support that, how we work locally where we are, regionally where we're able to, and nationally in any possible chance that we can, to champion research and how the impact that would have for patients and families, but of course also for ourselves as the biggest workforce in the NHS. So there are real developments happening, and everything that I hear wherever I go, including Helena's kind of comments, is really important, because how do we transform a culture, in essence, so that it's not unusual? It's core business for nurses and midwives, not only to be supporting the delivery of research, but to be leading it and leading teams of nurses and midwives and multi-professional members on stuff that will transform care, which is why we're all here. So, you know, it'd be great to hear from any of you outside of today as well on that. Would be great to engage with any of you as we take the strategic plan forward nationally. And Hannah, you're part of the Professional Shared Decision Making Council for Research, aren't you, as well, that we have, where we're having very much similar questions, aren't we? How do we take it forward, those big steps? So thank you.
Thanks, Jo. Helen, go on, you look like you're going to say something.
No, it's just a big sigh.
Oh.
Yeah.
Wasn't expecting
I've just been told my microphone appears to be noisy.
Oh, okay. So, I mean, great session, thank you. And it's really good to meet you. Chloe, I think definitely you've joined from your car on your way to Norfolk, so you have to come and see us. It would be great. Thank you.
Louise, Chloe and I met a little while ago, didn't we, Chloe? It was just phenomenal to hear about the things that you were doing, Chloe. And I did say at the time, come and keep in touch, keep talking to us.
Definitely, Elly.
It would be great.
Yeah, we had a good chat about all different routes, didn't we? We were talking about like routes with research, specialist nursing, ACP. So I'm really not sure at the moment, but that was really useful. Thank you.
I think one of the joys of clinical academic careers is that you have that flexibility of having both. You know, I think that and as you say, Jo, it's about the fact that it's embedded. It's not an extra. It's not a bolt-on. What we say at the evidence in nursing midwifery course is it is part and parcel and integral to everything we do to ask those questions. So, yeah, brilliant.
Absolutely, Elly. And actually, there's a piece of work with our ACP colleagues on what does research leadership look like in terms of an ACP role. So it's that and that, not that or that. And I think that's where, as evidence-based practitioners, some of us will perhaps have an advanced pillar in some element of it. But for our patients, they deserve no less than having many nurses and midwives with real expertise in research. And all of us should have a confidence and an engagement with research and evidence. So, yeah, that's great to hear. Thanks, Chloe.
Wonderful, thank you, Jo. So, if people want to head back into the main conclusion, we'll be starting that in 5 minutes' time. Absolutely delighted to meet you all today. Thank you for coming along, and it would be lovely to hear from you in the future. So thank you very much, and I hope you enjoy the sunshine this afternoon and the lovely weather planned over the weekend. It's Friday.
Yeah.
Wonderful.
Thank
you very much. Pop over to the other side. Thank you. Thank you. Thanks, Hannah.